Welcome to our channel. Today we're diving into a crucial health topic that affects millions worldwide: diarrhea. We've all been there, right? That sudden, uncomfortable urge to run to the bathroom can really throw a wrench into your day. But don't worry, you're not alone. Diarrhea is incredibly common and, thankfully, usually short-lived. From simple dietary changes to understanding when it's time to see a doctor, we'll cover it all. So let's get right to it. When you have diarrhea, your body loses fluids and electrolytes at an alarming rate. That's why staying hydrated is absolutely crucial. Think of it like this. Your body is like a car engine, and fluids are the oil. Without enough oil, the engine overheats and can't function properly. Dehydration can make your diarrhea worse and lead to serious complications. So how much should you be drinking? Aim for at least 8 glasses of water per day, and even more if your diarrhea is severe. But water alone isn't always enough. You also need to replenish those lost electrolytes: sodium, potassium, and chloride. That's where oral rehydration solutions, ORS, come in. These handy packets are like a magic potion for your gut. ORS contain the perfect balance of electrolytes and glucose to help your body absorb fluids more effectively. Remember, staying hydrated is the first and most important step in treating diarrhea. You've loaded up on fluids, which is fantastic. Now let's talk about food. When you have diarrhea, your stomach is like a roller coaster gone haywire. The last thing you want to do is add fuel to that fire with heavy, greasy, or spicy foods. Instead, think bland, my friend, bland. And no, I'm not talking about boring. I'm talking about the BRAT diet: bananas, rice, applesauce, and toast. These 4 simple foods are gentle on your stomach and can help firm up those loose stools. Bananas are rich in potassium, which gets depleted when you have diarrhea. Rice is easy to digest and provides energy. Applesauce, especially if it's homemade without added sugar, can soothe your stomach and add some much-needed fiber. The BRAT diet isn't a long-term solution, but it's a great way to give your gut a break while it recovers. Sometimes dietary changes in hydration aren't enough to tame the diarrhea beast. That's where over-the-counter medications come in. 2 popular options are loperamide, like Imodium, and bismuth subsalicylate, like Pepto-Bismol. Loperamide works by slowing down the contractions of your intestines, which helps reduce the frequency of bowel movements. It's like hitting the brakes on that runaway train in your gut. Bismuth subsalicylate not only reduces inflammation in the gut, but also decreases the amount of fluid secreted into your intestines. However, it's important to note that bismuth subsalicylate can sometimes cause black stools or a black tongue. As always, it's crucial to follow the recommended dosage instructions on the packaging. And if you have any pre-existing medical conditions or are taking other medications, check with your doctor or pharmacist before starting any new over-the-counter remedies. Let's talk about the superheroes of your gut: probiotics. These are the good bacteria that live in your intestines and play a vital role in digestion and overall health. When you have diarrhea, the balance of bacteria in your gut can get thrown out of whack. Probiotics can help restore that balance, like sending in reinforcements to fight off the bad guys. You can find probiotics in supplement form at most drugstores and health food stores, but you can also boost your intake through your diet. Yogurt with live and active cultures is an excellent source of probiotics. Other fermented foods like kefir, sauerkraut, and kimchi are also teeming with beneficial bacteria. Incorporating these foods into your diet can provide long-term support for your gut health, not just when you're battling diarrhea. Remember, a healthy gut is a happy gut. And probiotics are a great way to show your gut some love. We talked about the importance of hydration earlier, but let's dive a little deeper into the magic of oral rehydration solutions, or ORS. These little packets are like a superpower against dehydration, especially when diarrhea is severe. ORS contain a precise mix of electrolytes: sodium, potassium, and chloride, which are essential for your body to function properly. When you have diarrhea, you lose these electrolytes through your stool, and it's crucial to replenish them. ORS provide those essential electrolytes in a form that's easy for your body to absorb, even when your stomach is doing flips. You can find ORS packets at most pharmacies and supermarkets. Just mix the contents of 1 packet with clean drinking water and voila! You have a powerful hydration solution. Having ORS on hand is like having a secret weapon against dehydration. We've covered what to eat when you have diarrhea, but now let's talk about what to avoid. Certain foods can actually aggravate your symptoms and prolong your misery. Think of them as fuel for the diarrhea monster lurking in your gut, and you definitely don't want to feed that monster. First on the list, dairy products. Milk, cheese, and ice cream can be difficult to digest, especially when your stomach is already upset. They can worsen diarrhea due to lactose intolerance, which is common during bouts of diarrhea. Next up, fatty and greasy foods. Think fried foods, fast food, and anything dripping in oil. These foods can spell disaster for your already sensitive digestive system. Avoid whole grains, raw fruits and vegetables, and beans until your symptoms improve. By avoiding these dietary villains, you'll give your digestive system a much-needed break and allow it to heal faster. Most cases of diarrhea resolve on their own with home care. However, sometimes you need a little extra help from your doctor. If your diarrhea is severe, persists for more than a few days, or you have other concerning symptoms, it's time to seek medical attention. Your doctor will assess your symptoms and medical history to determine the underlying cause of your diarrhea. In some cases, they may prescribe medications to address the specific issue. For instance, if a bacterial infection is the culprit, antibiotics might be necessary. In other cases, your doctor might prescribe medications to help control the symptoms of diarrhea while your body fights off the underlying cause. Remember, it's crucial to follow your doctor's instructions carefully when taking prescription medications. Don't hesitate to ask your doctor or pharmacist any questions you have about your medication. Zinc often gets overlooked, but this mighty mineral plays a crucial role in immune function, wound healing, and yes, even diarrhea relief. Studies have shown that zinc supplements can be particularly effective in reducing the duration and severity of diarrhea in children. Zinc works its magic by fighting off infection-causing bacteria and viruses in the gut. It also helps to reduce inflammation and promote the healing of damaged intestinal cells. Zinc supplements are available in various forms, including capsules, tablets, and syrups. It's always best to consult with your doctor or a qualified healthcare professional before starting any new supplements, including zinc. Remember, even though zinc is a naturally occurring mineral, taking too much can have adverse effects. For centuries, people have turned to nature's medicine cabinet to find relief from various ailments, including diarrhea. Herbal remedies can offer a gentle and often effective approach to soothing the digestive system and alleviating discomfort. One popular herbal remedy for diarrhea is ginger. This spicy root has potent anti-inflammatory properties that can help calm the gut and reduce nausea. You can enjoy ginger in various ways. Brew a cup of ginger tea, add fresh ginger to your meals, or take ginger capsules. Chamomile is another soothing herb that can work wonders for an upset stomach. It has anti-spasmodic properties that can help relax the muscles in your digestive tract, reducing cramping and diarrhea. Chamomile tea is widely available and a comforting choice when you're feeling under the weather. Remember, while herbal remedies are generally safe, it's essential to consult with your healthcare provider before using them. While most cases of diarrhea are nothing to worry about and clear up within a few days, there are times when it's crucial to seek medical attention. Ignoring the warning signs could lead to complications, so it's always better to err on the side of caution. If your diarrhea persists for more than 2 days without improvement, or if you experience severe dehydration, don't hesitate to contact your doctor. Signs of dehydration include excessive thirst, dry mouth, dark urine, weakness, dizziness, and confusion. Additionally, if you have a high fever, over 102 degrees Fahrenheit or 39 degrees Celsius, along with diarrhea, it could indicate a more serious infection that requires medical attention. Other red flags include blood or pus in your stool, severe abdominal pain, or unintentional weight loss. If you have any concerns or if your symptoms worsen or don't improve with home treatment, reach out to your doctor. They can provide a proper diagnosis, determine the underlying cause of your diarrhea, and recommend the most effective course of treatment. Thank you for watching. We've covered a lot of ground today, from understanding the causes of diarrhea to exploring various treatments and remedies. Remember, always consult with a healthcare professional for personalized advice. Diarrhea can be uncomfortable and disruptive, but with the right knowledge and tools, You can manage your symptoms effectively and get back to feeling your best. Don't let diarrhea keep you down. Check the description for consultation with the specialists and health professionals.